Implants last 10 years and then you have to come back and get them changed out. The basic rule of thumb with implants is if it ain't broke, don't fix it. So I've seen implants in for 10, 20, 30 years with no problems. With saline implants, it's fairly obvious when an implant needs to be changed. The saline implant is like a balloon. A tiny hole in it causes all the water to leak out, and it's usually down flat within 24 to 48 hours. With silicone implants, it's a little bit more difficult to tell. Sometimes there can be a little bit of discomfort, sometimes there's some hardening, sometimes it's just picked up on a mammogram. Very rarely does an MRI need to be used to find a broken implant. So that can occur, as I said, 10, 20, 30 years down the road. The 10-year figure came from the fact that if you look at statistics for the current crop of breast implants, at about 10 years you start seeing a small failure rate, which is around 4%. And then it gradually increases out to eventually 100% somewhere down the road. But the 10-year figure is not a magic number. Lastly, a few words about contracture. Like any surgery, breast augmentation can have complications or problems. Things like bleeding or scarring or infection, which are extremely rare but can happen with any surgical procedure. The issue that's unique to breast augmentation is something called capsular contracture. Again, there's an urban legend that the implants actually harden. The implants are as soft as the day that they went in. What happens with every implant is there's a circumferential ball of scar tissue that forms within several days. This ball of scar tissue forms around the implant and is basically round. And usually it's much bigger than the actual implant. This allows the implant to roll around inside it and move and look natural. For some reason, in some people, this ball shrinks down circumferentially and causes the implant not to move. This looks like a firmer, harder implant. Sometimes it makes it look round, sometimes it pulls it up, sometimes it's associated with pain from pulling on the nerves and discomfort. Usually we can treat it with a laser treatment and or oral medication. In some cases you have to go back, remove some of the scar tissue or release it, and sometimes even replace the implant. The current thinking about contracture is that it's actually caused by a very, very mild infection from your own bacteria on your skin. In surgery, we wear gloves and use sterile technique and use antibiotic, antiseptic soap to clean the skin, but that doesn't get rid of 100% of your skin bacteria. The only way to get rid of 100% of your skin bacteria is with a blowtorch, which is not acceptable. So there's a small number of skin bacteria which generally don't cause any problems. In some people, they seem to get into the incision and around the implant and cause a very, very mild infection in the scar, which causes the scar to shrink. Now, during surgery, we actually put antibiotic solutions to help prevent this, and people get antibiotics through their veins, but nevertheless, a small number of people still get these types of issues. Research has been going on for capsular contracture for the last 25 years, almost ever since breast implants were around. But there's still no 100% solution. So that's the most common complication. In my practice, about 5% of people need to go back. Nationally, it varies, can be up as high as 20% that need to go back to have the implants revised. This brings us to the end of our tutorial. I'm Dr. Andrew Kaczynski of Advanced Concepts in Plastic Surgery, where art, science, and beauty come together for you. For more information, please come to our website, drkmd.com. Thank you.